This is Dr. Green with Momenta Chiropractic, and today Dr. Holland and I are going to go through a video series all about sciatica. So we're going to talk about what sciatica is, how we go about diagnosing it, how we go about treating sciatica, and some of the rehab exercises that we use for patients in office to get them through that recovery process. So just to start off, let's talk a little bit about sciatica and get into some of the anatomy so that we can get a better idea before we get into some of those other videos there. So starting off, sciatica is technically a diagnosis, but it refers to a host of symptoms that involve the sciatic nerve, which is where it gets its name. So sciatica is typically pain, numbness, tingling, and some weakness felt either stemming from the back into the back side of the hip and the glute or the buttock, into the lateral thigh or even posterior thigh into the hamstring, going all the way down the leg into the foot, and sometimes even into the toes. And that's because the sciatic nerve has branches that go all the way down the leg and into the foot. So sciatica refers to symptoms that are felt anywhere along that pathway of that nerve. So to make this make a little bit more sense, the sciatic nerve itself stems from the nerve roots, which are these small spinal nerve roots that come out and exit the spinal canal, and they're made up of the L4, L5, S1, 2, and 3 spinal nerve roots, okay? So these exit the spinal canal and then they form together to make the sciatic nerve, which then exits through this little notch here called the sciatic notch as it runs towards the back side of the hip and then down the leg. And so because it comes from all of these nerve roots that exit the spine, anything that compresses the nerve roots will cause symptoms that go all the way down that sciatic nerve pathway. That's why the two main causes of sciatica include disc herniations and then bony changes that add compression to the spinal nerve roots. All right, now that we have an idea as to what sciatica is and about some of the anatomy involved, we're going to dive into the next couple of videos here where we're going to talk about how we go about diagnosing sciatica, how we go about treating sciatica, and some of the rehab exercises that we use with patients who are experiencing symptoms of sciatica. So be sure to check those out.